Hello everyone, this is Dr. Tom Chaney from Living Health Integrative Medicine in Annapolis, and today in this video I want to talk all about the immune system and supporting your immune system. I'm going to go over specifically what I'm doing to support and boost my immune system through these winter months. This is a question that I'm hearing and getting from many patients looking for advice, looking for help. So recently, Dr. Steph and I, we did this podcast here, how to boost your immune system for the upcoming season. And so in this episode, we cover a lot of data. So you can find this whole episode. You can watch and listen to the entire episode on our blog. So I'm on our website now, mylivinghealth.com. If you just go under resources, you go to blog, you're going to find this link that I'm on here, this page, how to boost your immune system. These are all the things that we talked about on this episode. Natural strategies to keep yourself healthy. We went over the latest research on integrative and holistic medical therapies to fight infection. We went over some of the vitamins, minerals, and herbs to help boost and balance the immune system. Strategies to be proactive and to prevent viruses and infections, colds, flus. And so in this video, I really just want to skip down and go through these downloadable handouts. These are two of the handouts that we went over on this podcast. So this is what I'm doing. I'm following this immune support supplement handout here. So if you click on this, then you're going to get this handout will pop up, and this is the handout that that you'll have access to. And this goes over the schedule that I'm following. So you can see up at the top here, wake up. So wake up, I'm not doing anything right away, but if I was doing something, sometimes I'll do like a probiotic right when I wake up, which is totally fine. You could definitely add that in there, and that would be helpful during this time of the year. I'm not doing that right now. This is specifically for my immune system. So at breakfast, I'm taking 1 scoop of monolaurin. So monolaurin is lauric acid. It's made from coconut. It's got antiviral, antibacterial properties. So I'm doing 1 scoop in the morning with breakfast. I'm also doing 1 scoop with dinner. So 2 scoops a day. And then under the capsules, you can see that I've got several capsules that I'm taking. I'm doing an active multivitamin. So I do 1 in the morning and 1 at night. All of these supplements, you can find them at livinghealthmarket.com. So I'm going to take you there in just a minute just to kind of go over some of these supplements so you can see exactly where they're at. But if you just search on Living Health Market and you search Active Multi, you're going to see a couple different options. You're going to see a powder. So the powder is great. You can add that to water. You can sip on that. So you could add that to water in the morning. You could add that to your water, say in the afternoon or right before dinner, and drink on that. It's flavored. It's like a berry flavor. It's a great way to get your nutrients and also flavor your water at the same time. But these all have active nutrients in them, so they're in their active form. So that's really important as well. The next capsule is curcumin complex. So curcumin complex, I'm doing 1 in the morning. I'm doing 1 at dinner. I'm going to take you over to our website. So this is livinghealthmarket.com. Right now I'm on Resveratrol Synergy. But if you go up here to the search bar and I just do curcumin, you'll see curcumin complex comes up. And so this has a tremendous amount of antioxidants, helps with cell protection, joint health, organ health. I mean, this is a great supplement. If you want to read and get more information, you can click there. This has all of the data, including the research supporting this supplement. So all the references are down here. But if you just go ahead and one of the things it talks about is the form of what we see is curcumin is great, and we know that turmeric is great, but part of the problem is absorbing it. So this formula actually contains a patented formulation, this BCM 95, which actually makes it more bioavailable, so your body can absorb it and utilize it much better than just the generic off-the-shelf, the mass-produced, commercially available stuff that you're going to find in most of the major, whether it's the grocery stores, the drug stores, the pharmacies. So they don't have, you won't see this combination there. So that's really important. So, so that's curcumin complex. Let me go back to my handout here. So next one is resveratrol synergy. So resveratrol synergy over here. Let me just close this guy and this guy. So resveratrol synergy. So let's check that one out. All right, so resveratrol synergy comes up, and once again you can see that this helps with methylation and improves absorption and ability. So it's got a lot of antioxidants. Once again, if you click here, you can see everything that it has in it. Same thing, it's going to give you all the data. So there's 3 powerful antioxidants in this formula, and they all work together. And so resveratrol, you've probably heard of. Quercetin, you've probably heard of. And then there's this other supplement here, this other nutrient, pterostylamine. So that one has been shown to synergistically work well with resveratrol and with quercetin. It's an activated form of resveratrol. Having trouble getting that one out. So this goes through and tells you and explains in more detail how they work together and how the absorption, how these all aid each other in their absorption and bioavailability. So that's resveratrol synergy. Next is omega-3 mg. So I take either I take either omega-3 mg. I'll show you that one. So omega-3 mg, that's a capsule as well. So this is a great supplement. So once again, it's getting those omega-3 fatty acids that you need, the EPA, DHA. Most of us are overburdened with the omega-6s. We have a deficiency in omega-3s, so this is going to help with this. The bioavailability on this as well is, once again, you can read through on that. If you click here, it talks about, once again, this has a patented formula as well because of the absorption, and that's really important. A lot of these commercially, I can't emphasize enough, if you're buying commercial vitamins off the shelf, many of them have been tested and show that they actually do not contain what's on the label, so that's a problem. Some of them contain things that are not on the label, another problem. And the other thing is the bioavailability of these nutrients that you're putting into your system. So this could also just be garbage that you're putting in your system, and your system is now having to clear these garbage nutrients, and it's more of a toxic burden than anything at all. So this goes through all of the benefits, so you have access to that on our website as well. The other one that I wanted to show you, if you wanted to do a liquid, I will do this one occasionally. Let's see. So omega emulse. So this is an emulsified omega. So this is a liquid. You keep this in the fridge. Once again, it's got your EPA, DHA. It's got all of these important nutrients that are so important for your body. Okay, so omega-3 mg, and then zinc. So zinc, taking 1 dose in the AM, and so I'll show you that one. So this is our zinc supplement here. So I'm doing 1 of these in the morning. And now the liquids. So down here are the liquids. So D3 emulse, I'm doing 4 drops. So my goal is to keep my vitamin D up at around 80. That's where I want to keep it. So this may vary depending on how well you absorb it and how much of a need your body has for this supplement. So when you're getting your blood work done, make sure you're asking your doctor to check your vitamin D. That's very important. But that's the D3 emulse, so 4 drops in the morning. Liquids, so here are the liquids. So this is before you eat. I'll do glutathione PL. So glutathione is an antioxidant. So I'll show you that one. So glutathione, our glutathione is a nanoparticle. It's just, you pump it right, it's a liquid, you pump it right into your mouth. It gets absorbed into the oral cavity, so just swish it around for 30 to 60 seconds. It's very absorbable. Once again, we want to make sure that a lot of our patients, they don't have very good gut health, intestinal health, so this is a way to bypass the stomach. So once again, this is best taken on an empty stomach. That's why we're going to do it 15 minutes before you eat. So that could be moved right here when you wake up, and then before you eat, you're going to do another 2 pumps. So I do 2 pumps before breakfast, 2 pumps before dinner, and then the other one that I'm taking is the vitamin C, and I do C-Plex. We have a couple different formulas for C, but the C-Plex is also liposomal nanoparticle. It's going to look very similar to the same type of container. I'll show you that. Let's see. Okay, here's the C-Plex. So C-Plex is here, and same thing. You want to take it on an empty stomach, hold it in your mouth 30 to 60 seconds before swallowing it, and just swish it around. And you're going to do 2 pumps. So I do 2 pumps right before breakfast, and I do 2 pumps right before dinner. Okay, so there's some more data down here, and it talks about some of the things that I mentioned as far as replacements. If you wanted to do a powder versus a capsule, or if you want to do a liquid versus a capsule, then we have some alternatives. So they're all down here. But this is something that, these are all questions I'm getting from patients. What should I do? I've got patients that have family members that are sick. I've got patients that are ill as well. So they want to know what to do to shore themselves up. This is what you should be doing, and this is what I'm doing. So this is your immune support supplement. So then if you do feel like something is coming on, so you got a tickle in your throat, you got a headache, stomach aches, something just doesn't quite feel right, then we have this one as well. This is the onset of a cold or flu, and I'm not going to go over that in this video, but you have access to it. So it's going to add a few things. It's going to up the dosage, and so you've got access to that as well. So I'll go over that in another video, but I just wanted to cover exactly what I'm doing to shore myself up. I'm in contact with patients daily, and I want to make sure that I keep my immune system boosted and supported, and this is how I'm doing it. Okay, guys, so I hope you enjoyed this video. If you did, go ahead and like it, and that really helps the channel, so I appreciate that. If you have questions, leave them down below, and I will see you in the next video.